Hello and welcome to St. Sebastian Church Mission Update. My name is Suman and I am a member of the PCC and also a member of the Mission Committee here in our church. The aim of the Mission Committee is to recommend to the PCC on how our church members' mission investments are allocated. And we also aim to bring regular feedback from those supported individuals and organizations. So today, I'm joined by my dear friends from Nepal who are working tirelessly on improving the critical care services in very challenging circumstances. We've been supporting Nepal Critical Care Development Foundation and in their work since 2019.
Hello everyone, I'm Kavita Sitola from Nepal. I'm General Secretary of Critical Care Nurses Association of Nepal and also the General Secretary of Regional Federation of Critical Care Nursing SARC. And I'm currently working as a critical care nurse in a tertiary level hospital in Nepal.
Hi, I'm Dr. Subhash Acharya. I am a critical care physician. I have been working as a critical care doctor in Nepal since 2012. Uh, I am also the president of Nepal Critical Care Development Foundation, which is a non-profit making organization, a non-taxable charity organization, which was basically established to develop and support critical care in Nepal.
So you guys have been very, very busy, like all the healthcare professionals around the world. What has your experience been like dealing with the COVID-19 pandemic?
As with across the world, when cases initially start to increase, fortunately, we had some time because it took like few months for the number of cases to increase in our part. So we were behind like 3 months. So in the beginning, the scenario was like very chaotic. Not only because of the fear factor, but also because of the unpreparedness of our healthcare system to deal with such pandemics. Like we had like very few infection control nurses in the country, and talking about ICUs, we have like ICUs, very few ICUs, limited number of beds, even inside Kathmandu, but outside in rural areas, like the number of beds are like very less. Currently, Nepal is divided into 7 provinces. Out of the 7, in 2 provinces, there are no critically ill beds, like there are no ICUs before this pandemic. So there was a huge challenge of trying to create this critical care beds, number 1. And number 2 was to train the doctors and nurses working in this ICU. During the initial periods of the lockdown, we had time where the number of cases were less. So we were able to focus on capacity building across Nepal. Like the government also diverted all its resources to build up like oxygen supplies, beds, monitors, at least monitoring beds. And also we worked in the beginning to develop like trainings, like short courses, online courses for various doctors and nurses, which was around October was the peak for us. At and mid-October was like very bad. We didn't have any ICU beds. Like all ICUs were full. Whole day we try to, like we were negotiating beds, trying to create more beds. That was the scenario in October. And then fortunately cases start to go down after that. And then we had a bit of relief. But the situation early phases were pretty bad, and basically because of our ill preparedness, like nobody in Nepal, like nobody was prepared for such a massive scale of disaster. Problem was not only patient management, but the social stigma behind COVID was creating much more problem. Like people were like denying doctors and nurses to go to their to area. They're not letting people to go to their cities. Even they didn't want nurses to come back to home. They didn't allow doctors to go back to home, and so we have to create facilities. We have to find hotels, rental places to keep doctors and nurses who were working in COVID areas. And those logistic management were more problematic. At our hospital, we had to get 2-3 hotels and keep our doctors and nurses for quarantine in those places, because they were not allowed to go back to their houses. People were shouting against, demonstrating against doctors and nurses being kept in the hotel in their locality. At times we even had to take help of police to negotiate with the local people to allow healthcare workers to be kept in hotels in quarantine. It was difficult for mostly for nurses, because most of the people were staying on rent in Kathmandu. The landlord were not allowing the nurses to come back to their houses. So we had to create facilities, places in the hospital for the nurses to stay, throughout 1 week, 2 weeks. That problem was a bit more, rather than dealing with the clinical management of the patients.
That sounds really horrendous.
Yeah, and
And
even
one
people want to see the COVID negative report before entering their home.
you know that the salary of nurses is very low in Nepal, and even then, the private hospitals were being closed because of COVID. They were not no patients, so everything, and people were laid off jobs. They were doctor and nurses were said, okay, now no more, we don't hire nurses, your job is gone. Okay, so, and people were salary were not paid to so many doctors and nurses. Kavita and our colleagues did a great job. We created a critical care nurse support fund. We collected money from so many doctors, nurses, or team, and then get a pool of made a pool of 8 to 10 lakh rupees, and we gave that money to the nurses who were not paid salary. What do you call it? A soft loan basis, interest free. They need to buy food to eat and before they go to work. So we had to do that, and many nurses benefited from that, and then which was interest free. And then later, when they can, when they when their hospital pays them back, they will return the money slowly. We made that provision so that our nurses could at least survive this pandemic, and had some money to take care of themselves. Nurses who are already on low salary, they have to pay the rent. Landlord do not want them to come to houses. They don't have money to buy food and pay rent, and then they have to take care of COVID patients, doing 12 hours of duty or even more, and taking care of very sick patients. There was a fear of death in everyone, and nobody wanted to go and touch the patient, be near the patients. And but in critical care, in ICUs, you can't say that. You have to be there. And in the initial phases, we didn't have even proper PPEs. We didn't have hazmat suit. We didn't have N95 masks. It took 2 to 3 months for us to have proper N95 and then other hazmat suits. But the morale was too low, not only with the doctors and nurses, but with everyone. Everyone. And another problem was availability of bed. People were trying to secure a bed for themselves. Corporate houses were trying to find beds in private hospital, book a bed for their staffs in private hospitals.
People actually died without a proper because the healthcare is not good enough. Would you say that?
Yeah. Where we found people death at home, in home isolation. They were on home isolation. So few people even died without proper monitoring at home, and they were found dead. So many people were devoid of healthcare facilities because they one, they did not have access. The transportation system was very bad that time. There were no movement.
So I just want to move the conversation towards your organizations, really. I know you've already touched on a lot of things that you're already doing. Kavita, maybe I'll ask you, about the Critical Care Nurses Association of Nepal. What sort of projects that you're doing?
And basically, we are running a critical care nurse training program, which is a 3 months training program. And we focus this training program for critical care nurses inside the capital and as well as outside the Kathmandu Valley, also for the rural nurses who are working in rural area. Because in Nepal, there is no formal education and training on critical care nursing.
I think one of the projects I was really interested in, Subhas, is around the ICU Care Box. That was the initiative that Nepal Critical Care Development Foundation kind of started. But can you tell us a little bit more about your project?
We developed this ICU Care Box concept back in 2013. When we started our Critical Care Foundation, what we felt was there a lack of resources, like the small things, consumables, and available in ICU. The patient has a pneumothorax and we need to put a chest tube to save the patient, but which costs like how much, £1 or like 1.5 pounds, and it's not available. And then you have to send the patient family to buy that chest tube, bring it to the ICU, and then you put it, like you waste another 1 hour, like maybe at least. So to avoid this delay in patient care, which can sometimes be very at the cost of patient lives, we developed this ICU Care Box. We provided basic supplies like this chest tube, or central line, or endotracheal tubes. And those patients who can afford will buy it and keep the replacement. But for those patients who are not affording, the foundation will bear the cost and do that. And this in fact become a very handy project for all of us working in ICU, because then we didn't have to wait for hours to take care of sick patients, waiting for a small like consumable or objects. So that was very useful. That, and we found that the cost of one ICU care box to run one ICU is like around £1,500 for 1 year, which was not a big huge amount of money. We started collecting funds, donation, and started this. And then from one ICU we started this to 3-4 public hospital ICUs. And now this ICU care box, we only run this in ICUs which are new public hospitals, where the level of support from government or other resources are poor. We identify that and we support those ICUs. We call it a box because initially we designed it in a box and we send it to the ICU, but eventually it turned out to be a cupboard, like full of but we call it ICU Care Box. But it's one cupboard full of consumables and supplies. Like when it's out of stock, we go there, the nurses keep the record, and we go and refill that, and keep the stock so that the care box is complete.
Part of here, St. Sebastian's Church, obviously we're trying to help projects like yours. What do you say to people? How can people help you?
I think investing in like this supplies, could be one modality. But if we invest in development of a system or a process, that will be everlasting. If we were able to develop even like one person, one nurse who is like serious, passionate about ICU, and then if we are able to place that person in that ICU, that nurse or doctor will make a huge difference in the care of the patient. We need to train people across the region. Now, if you see, like we have very few ICU trained nurses, so we started like identifying nurses from various part of the country and trying to get them trained in critical care. I think it will be very great if you all could support us, trying to get these nurses come to Kathmandu and get them trained and then send them back. They will be the key resource person. They will be the leaders there, who will be working and developing critical care. So we don't have to pay them like their salary, because they will be getting salary from their like hospital. We can arrange for that, but we'll need to find a spot for them in the training, which we would do, which would collaborate with Critical Care Nursing Association and Foundation will collaborate and do that. And we can get their like training fees. We can get their, some sort of accommodation or hostel here. Province to Janakpur, like does not have a proper ICU in the whole province, which is one of the most populated area. So there's like only one government hospital and no ICUs because there are no trained people. So I think that could be one modalities or areas where you all can help us. And I think that will be a bigger, impactful process.
Because this COVID gave us a big lesson to and make us realize that the training of nurses and doctors in critical care areas is very important to save the life of the people.
Well, thank you very much both for giving me your time to come and speak to us today, and just giving insight into what it is like, working as intensive care professionals in Nepal. I'm really, really grateful for your time, and let's hope that we can somehow work together and help you out the best way we can. Okay, thanks for giving me your time.
Thank you, Suman.
Thank you so much.